Beth. I'm a licensed speech and language pathologist, and I'm coming on right now because I've seen a few videos of parents asking about whether or not they should purchase communication devices or apps themselves. Some parents don't have insurance yet, but these children are on an IEP at school. If your child is attending public school and is on an IEP and they are minimally verbal, nonverbal, they're not speaking, maybe they have some words, but they're not using verbal language functionally, and especially if they have a diagnosis of autism spectrum disorder, hyperactive speech, or Down syndrome, or any diagnosis coupled with not having functional speech, there's no reason why that school should not conduct a AAC assessment, an augmentative alternative communication assessment. Here's what you can do. If they're already on an IEP and you want this done, you can put in writing that you're requesting an AAC evaluation for your child. You put the child's name, their date of birth, the school that they attend, and the date that you're writing that. Get it into the school. You can email it or you can hand it to the school district. Another option is in writing request an IEP revision and put your child's name, date of birth, and their school and the date. Even if you just had one yesterday, you can request an IEP meeting anytime. So put that in writing, put the date on it. You can send it in an email. You can write it out and bring it to the school district. Whichever you feel more comfortable with. Then they will need to hold an IEP. And then what you're going to do is you're going to request an AAC assessment when you get to the IEP. You can put it in writing in an email before you actually attend the IEP. There's a paper trail of you requesting a few times. Some schools have speech and language pathologists like myself that conduct the AAC assessments. If this is the case, just make sure that speech and language pathologist has experience with AAC assessments and with the use and trialing different devices and different apps. That's going to be super important for your child to get the correct device and the correct application. Some schools have speech and language pathologists working with assistive technology department, so they work together, which is fine. And then other school districts sometimes just have an outside, like a third party provider that does an AAC assessment. They're not sure what to say in the IEP meeting or how to respond if they come back and say, we can't do that. Just get an advocate who knows IDEA, who knows everything about IEPs, and who can help you.